So how do you get the whitest teeth possible? I'm sure you've seen different products advertised that will whiten your teeth. You've seen different claims from different companies, but how do you get your teeth as white as can be? Well, in this video, I'm going to explore the different options that you've got available to you. Hi, my name is Dr. Arnold and I'm a dentist in Lancashire, and a lot of people will come to me wanting to get their teeth whiter. And what I provide for my patients is tooth whitening as a way to get their teeth much whiter. This is tooth whitening where we use whitening trays as well as a gel that lifts the color of the teeth. Now, one of the first steps you can take to getting whiter teeth is to have a hygiene visit, having a scale and polish with your dentist, with a hygienist or a dental therapist, and this will lift extrinsic staining on the outside surfaces of your teeth. That can lighten up the shade of your teeth. So that's the first step that I would say to take before embarking on the other processes that you can take when you're whitening your teeth. Now, a lot of people might go online to get whitening gels, and the danger with that is the fact that you don't actually know what's in those gels. Is it a safe amount of hydrogen peroxide or carbamide peroxide in that gel? You just don't know if you're buying it randomly, from a place online. Whereas as clinicians, we've got access to regulated tooth whitening products that are going to have the safe concentrations to whiten your teeth effectively. Okay, so we also make you whitening trays, bespoke made whitening trays, meaning that the whitening gels are not gonna cause any irritation or chemical burns to your gums. So again, you need a well-fitting appliance that's made to hold the whitening gels. And again, this is something I provide for my patients. The whitening gels, they work by lifting the color of the teeth and shifting anything that's causing staining within your teeth. Now, this can take a process of about 2 weeks of using the whitening gels, and it might be that you're whitening during the day for about 90 minutes and then whitening overnight whilst you're sleeping. So you can be doing 2 sessions a day to get the teeth nice and white. What I tell my patients is to make sure that they're not having heavily colored foods or drinks whilst they're whitening their teeth. So having a lot of coffee or tea or heavily colored foods like curries will work against the whitening effect. So for that 2 weeks where you're whitening your teeth, you want to make sure that you're staying away from heavily colored foods and drinks. If you're going to have a heavily colored drink, like let's say a red wine, just make sure that you're not letting it linger around your teeth when you're having it. What I find with my patients is once they've done the 2-week period of whitening, at that point, the whitening effect will last for about a year. And after a year, it's just about topping up on the whitening. So they might just buy a syringe or 2 syringes from the practice and use the whitening trays to then top up on their whitening. So you don't have to go through the whole process of getting a new set of whitening trays and going through the 2 weeks of whitening with the 4 gels. It might just be that you get a gel or 2 syringes of gel to top up on the whitening. So even though whitening is one of the safest procedures that you'll have carried out at a dental practice, it is important to know that with whitening, your teeth can be sensitive during the process. Myself, I get twinges of sensitivity whenever I whiten my teeth, but once I've stopped whitening, the twinges of sensitivity go away. So just be prepared for that sensitivity during the process, and just make sure that you're using a sensitivity-based toothpaste to help manage that sensitivity. Now, there's no hard research to say that whitening has any negative effect on pregnant women or women who are breastfeeding, but as an extra added caution, we just say wait until you've had a baby and you've stopped breastfeeding before you start whitening. Not that we've found anything that's exactly harmful, but we just take that extra added precaution. So normally with pregnant ladies, we just say to wait until they've stopped breastfeeding. I will tend to use a pea-sized amount of whitening gel in each of the spaces of the whitening tray. And then once that's done, make sure that's nice and secure in there. And I'll spend the 90 minutes or overnight in the whitening trays. And they're easy to take out at the end. So making sure that you're rinsing it with cold water, with lukewarm water, because if you're using boiling hot water, that'll deform the plastic and you'll have to have new whitening trays made. So when whitening, make sure to keep your whitening trays clean, but don't use hot water because that deforms the whitening trays. So what I tend to find is there are some patients who want the whitest teeth possible. And even though tooth whitening is a good way to get your teeth whiter, there's a certain level of white that it will never reach. So at this point, this is where you've got to consider having a material added to your natural teeth. Now, this might be composite bonding or composite veneers, which are shaped and carved onto your teeth. And you don't have to drill any of your natural teeth, you just add to your teeth as they are. Or you may have ceramic veneers, which are made in a lab, and then a dentist will stick them onto your teeth. And again, it doesn't necessarily mean you have to have your teeth shaved down. Now, what you'll see is people going abroad and having their teeth shaved down to pegs and then getting crowns or bridges on top of their natural teeth. Now, this is an aggressive way to get that same look. And the disadvantage to this is the fact that whenever you shave your teeth down, you shorten the lifespan of your teeth. So whereas if someone was, let's say, 50 years old plus, they don't have to go through too many cycles of that. If someone is 20 years old, 30 years old, they're gonna need these crowns replacing, these bridges replacing, and you get to a point where you haven't got enough tooth to work with. Now you're thinking about dentures or implants. So what I would say is, make sure if you're gonna get composite bonding or ceramic veneers, think about having it done in a minimally invasive way where you're not having your teeth shaved down to pegs. For some people, it may mean that they need to have braces first to put them into a better position, and that way you don't have to drill down your teeth to add to your teeth. So for some people, you can get your teeth added to straight away. For some people, because of your bite, you need the teeth moved into a healthier position first, and then you can add to the teeth with composite bonding with ceramic veneers. So it's just important that you're having your dentistry done in a safe way, which is going to last you a long time.